From the South Carolina Honors College, this is Polluting Patients. If the U.S. healthcare sector were a country, it would rank 13th in the world for greenhouse gas emissions. The goal of Polluting Patients is to teach people about the environmental and corresponding health impacts of the U.S. healthcare system and what we, as healthcare consumers, clinicians, and leaders, can do about it. Welcome back to Polluting Patients. I'm your host, Miley Phillips. So far on our journey together, I have described the problem that the healthcare sector poses for the environment and our health, as well as several of its little mini problems. But so far, I haven't really offered any solutions on how we can mitigate the impacts of the healthcare system so that our planet and ourselves can stay healthy. So today, that is what we are going to be talking about. Making our system green. Before we dive into all of the components of the healthcare system that can do work to become more sustainable, I want to briefly define sustainability just to kind of give the word a little bit more meaning in this context. Environmental sustainability refers to the ability to meet the needs of the present without compromising the ability of future generations to meet their own needs. This involves the balancing of using natural resources with the protection of the environment. So, what does this exactly mean in the context of healthcare? Environmental sustainability in healthcare is the ability to meet the needs of the United States population through the delivery of healthcare services without compromising future generations' ability to do so by promoting the health of the environment. This is accomplished through three main concepts. First is environmental management, which refers to the responsible use of resources in order to avoid their depletion. Next, we have the idea of a circular economy, which refers to the reduction, reuse, and recycling of materials to minimize waste. And finally, we have the concept of renewable energies, which refers to the implementation of clean technologies that generate energy and electricity, for example, solar energy. We will see these principles in action later as I discuss the different interventions that mitigate the healthcare sector's impact. So now that we know what sustainability means in this context, we can start to apply that definition and see the ways in which we can mitigate the healthcare sector's impact. So to start, I wanted to revisit artificial intelligence in clinical settings, as well as electronic medical records, and some of the things we talked about a few episodes ago. As we know from previous discussions, AI and electronic medical records are contributing to the environmental toll that the healthcare sector has. However, they also present a great opportunity to start mitigating impact. This is because, as we know, the issue with both electronic medical records and AI is rooted in their energy consumption and energy sources. So let's start with electronic medical records. If hospitals were to source all electricity for electronic medical records and their associated operating facilities from renewable, clean sources like solar, wind power, emissions would drop to equivalent amounts of that of paper record keeping. This reduction in emissions, coupled with the lack of need for processing and other supply chain factors that go into paper records, would actually create an overall net positive effect on the environment and complete electronic medical records transition into a greener, more sustainable tool than paper record keeping systems. Now, let's refocus on artificial intelligence in healthcare. In order to address environmental concerns with AI, healthcare systems need to adopt strategies such as energy modeling tools, life cycle assessments, and low carbon infrastructures for data centers. Furthermore, implementing approaches of a circular economy with AI, such as heat reuse from data centers and the technologies within the data centers, as well as equipment recycling. So kind of getting away from that whole idea of the planned obsolescence of technologies and reusing them and recycling them would start to mitigate the impacts that AI has. Now, let's take a look at another key place that the healthcare sector can mitigate its impact: medical waste. As you remember, there's a lot that goes into the generation, transportation, and treatment of medical waste. And sustainable interventions at all of these stages within medical waste life cycles are integral in lessening the greenhouse gas emissions and environmental degradation that results from medical waste. To start, we can again look at the treatment stage of medical waste life cycle. And to make it more sustainable here, a push to move away from incinerators is key. There are many strategies that can be employed here instead that sterilizes and treats medical waste. Again, with the idea of interventions targeted at the medical waste treatment level, a transition from transporting waste to be autoclaved offsite to on-site autoclaving is a great strategy that could be employed here, because we're not getting those emissions associated with the transportation of the waste and therefore reduce the impact. And remember from our episode on medical waste where I mentioned this idea of waste to energy facilities? Well, that's another great sustainable intervention for healthcare and medical waste. And this kind of goes with the idea that I mentioned earlier of a circular economy. Now, the waste to energy method turns hospital trash into a source of renewable electricity or heat for communities or the hospital itself. There's also a couple other ways we could treat waste, such as plasma gasification, pyrolysis, and microrecycling, that again all help to mitigate the impacts at the treatment and disposal level of the life cycle of medical waste. So we can make parts of medical waste life cycle more sustainable to mitigate its impacts. But what about just minimizing healthcare waste? That is also a great way to reduce the amount of stuff that is going into landfills that are then releasing methane and sulfur dioxide and nitrogen dioxide and leaching toxic things into our water. So this whole idea of minimization of healthcare waste includes the green procurement and selecting products where distance for shipping from manufacturer to hospital and clinical sites is minimized, with more eco-friendly packaging, so less plastic and things packaged with recyclable materials, as well as switching to reusable medical devices when appropriate. And this switching to reusables has a very positive impact on the environment. A 2018 study found that switching from single-use medical devices to reusable ones reduces all of the ecological impacts associated with the products, including the waste, in all categories except for water use. This is because water is used to treat and sterilize the devices so that they can be reused and recycled. Now, the highest mitigation potential for reusable medical devices was actually for reusable invasive medical devices over non-invasive ones. And an important aspect of this is when developing these reusable products is focusing on lengthening the lifetime of the reusable devices, because unfortunately they're not going to be able to be reused forever. So however they can be developed so that they last the longest is a very important factor when looking at the mitigation potential here with effects associated with medical waste. So now that we know what sustainability means and have closed the loop on sustainable interventions for things that we discussed earlier on in this series, I wanted to take a moment and describe to you all what a totally green health care system could look like in an ideal world if we had the ability to create it all from scratch. And this idea is what people in this field call a green hospital. Green hospitals and healthcare systems are medical facilities that integrate sustainability into its operations in order to reduce its carbon footprint, minimize waste, and improve patient health outcomes. In an ideal world, these green facilities would be how we built all new hospitals and clinics in the United States, but we know we don't live in an ideal world. However, if we take a second and step back into fairy tale land to create our perfect, ideal green hospital, there are 10 guiding principles that need to be in mind during its development and creation. So the first is leadership. The idea of sustainability needs to be promoted throughout the healthcare organizations by leaders within the organization that are committed to the green vision in order to energize and get employees on board. This is done through education for the leaders and employees, goal setting, and accountability throughout the organization, as well as external relations, including things like waste management and supplies procurement. And kind of going off that idea, the next principle that organizations have to keep in mind when developing a green hospital or system is substituting harmful chemicals with other safer alternatives. Next, we have better waste management, and we've kind of discussed that just a few minutes ago, so I'm not going to go back into all that. Our fourth principle is implementing energy efficiency as well as generating energy from renewable sources. Hospitals within this green system would integrate renewable energy sources into their infrastructure, such as solar panels and wind turbines. The clean energy that the hospitals themselves generate would minimize the system's use and need for traditional energy grids, overall mitigating their greenhouse gas emissions and lessening their carbon footprint. Another critical aspect of creating a green system would be reducing water consumption and promoting the recycling of water. Hospitals would implement methods like on-site wastewater treatment systems, like biodigestion systems that remove harmful chemicals from the water and produce gas, which could be used as an energy source for the hospital. Again, here's that idea of that circular economy and sustainability that I talked about earlier. With the improvement of water conservation infrastructure, including water harvesting techniques that would be used for non-potable purposes, as well as gray water recycling systems that treat and reuse water from sinks and showers and laundry facilities, all significantly reduce water consumption, which is a really big deal when it comes to the environment. Improving transportation strategies for patients and staff is also a big component of this idea of a green system. Now, this is where telehealth, which I think all of us at some point by now have experienced, comes in. Increasing the use of telehealth visits reduces the emissions related to patient transportation, as well as transportation for physicians and other hospital and clinic staff. So when healthcare organizations are designing their green hospitals, several telehealth dedicated rooms where providers can conduct virtual visits are within the blueprint and building plans to kind of increase the utilization of telehealth in order to reduce the need for transportation. Food is also a key aspect to a green hospital. Primarily, reducing food waste is one of the biggest things when it comes to looking at food in the healthcare system and overall reducing the environmental footprint of a hospital. But outside from this, changing menus that feature a plant-based option, which is an overall lower emission option than a meat-based meal, is another great strategy for sustainability in hospitals. Another idea that would be key in the development of a green system or hospital would be reducing the pharmaceutical pollution and developing safer pharmaceutical disposals. And our penultimate principle in green healthcare would be taking advantage of green building practices and the utilization of recycled materials in the building of the hospital in order to develop more resilient and healthier products and buildings. And finally, we have changing purchasing habits in ways that reduce environmental and human impacts is something that is critical to the creation of a green hospital or healthcare system. Now, like I said, in an ideal world, all hospitals in the future would be built as these green hospitals, and our healthcare sector would have this emphatic commitment to sustainability. And in this fantasy world, we would also have the ability to change our existing hospitals and infrastructure into ones that mimic this dream. But unfortunately, we are not living in this ideal magical world, and doing that would be extremely costly. So now we have to take this ideal and kind of mold it to our reality. Healthcare organizations throughout the healthcare sector in the United States need to focus on how they can improve what they are doing now, as well as implement sustainability. For example, hospitals could purchase and begin to utilize solar panels. This would help to, one, reduce their operating cost, benefiting them as it reduces their reliance on traditional electric grids and therefore cuts down on electricity-related emissions and carbon footprint. Additionally, hospitals can also start to implement reusable medical devices where appropriate, which cuts down on supply cost in total as well as the amount of waste that's generated. Many hospitals already do this in some fashion. For example, it's very common to see designated waste reciprocals for pulse oximeters and cardiac telemetry leads. And by properly disposing of these devices in the designated reciprocals, they can be recycled and then reused. However, the issue is that this doesn't happen very often, and I know this from my experience working in the system. And this is mostly due to the simple fact that there aren't many waste reciprocals for these devices throughout units within hospitals and clinics, and therefore everything just gets trashed. If you're looking at a patient room, there's always a biohazard bin, a sharps bin, and a trash can. But the reciprocals for the devices that can be reused are not in every patient room and are in fact mostly scattered throughout the unit. So if every patient room were to have these reciprocals, these things would start to get recycled more and reducing waste. So this is a very simple hospital level intervention strategy that could be implemented to mitigate impact. Additionally, implementing sustainable practices within operating rooms by using reusable devices and things like water surgical scrubs are also ways that hospitals that are currently operating can improve their impact. And not only does this come with a big benefit for the environment, but also hospitals benefit greatly here in the money department. United States hospitals that transitioned to a waterless surgical scrub saved $33 per year, as well as 2.7 million liters of water. Proper waste management led to annual savings of $694,000, as well as a 30% reduction in medical waste. Moreover, energy efficient practices in operating rooms can save hospitals $25,000 per year per operating room. And this is especially a big deal because ORs are the money makers of hospitals. Finally, the substitution of reusable medical devices over single-use medical devices, when appropriate, has saved systems $2.5 million in a year. Although initial implementation costs for some of these interventions that I mentioned can be high, they often end up paying for themselves and then some. So it's just overall beneficial for the hospital systems themselves, for the health of our environment and ourselves, for the healthcare sector to start making itself more sustainable. But so far, our system isn't really implementing these strategies and actually probably don't even know about them. But how can we let them know about these interventions and all the benefits, and also force the healthcare sector to make these changes so that it can start to mitigate its impact? Well, I will answer these questions in the next episode. And so with that, thanks for listening to Polluting Patients. Remember, a healthier planet is a prescription for healthier people. Keep pushing for sustainability in healthcare. See you next time.